Good morning, Chairperson and my dear friends. I'm presenting congenital bilateral upper eyelid eversion. It's a very rare disease, and this is the 58th case in the world. I reported this. This is a case report. It's not changing, so yeah. So I'm Dr. Nilesh Jain. This is a 12-hour-old female newborn referred from another hospital. She's a first baby to 22-year-old woman. Antenatal history was uneventful. She delivered with the cesarean section. And on general examination, she was afebrile with a tachycardia. And on eye examination, both the lids were totally everted. And there is a chemosis with a greenish discharge that is suggestive of infection. And on examination, with the help of Desmos lid detector, we just examined it and found that there is a cornea was clear and fluorescent staining was negative. So, blood investigation was done and shows leukocytosis, along with that increased bilirubin count. So we took the help of neonatologist and we started with the admitted in NICU and started with the IV antibiotic and phototherapy. And for eyes we just tried the manual inversion of the lid, but it was not possible. Then we tried in Bexel dressing also, but that was also not working. So then we tried 5% hypertonic saline dressing, and we changed it every 6 hourly. And along with that, we have started with the lubricating eye drop and broad spectrum antibiotic. And to our surprise, by 6th day, it was totally completely normal. So coming to the discussion part, so it is a very rare disorder. It could be unilateral or bilateral. So Adams in 1896 first described this case as a bilateral ectropion, double ectropion. And Seller et al. In 1996 reviewed the literature and found 51 more cases. And till now 7 more cases has been detected. My case is 58th case in the world. And no pathology has been put forward, but more common seen in Down's baby or collodion skin disease babies and black races. And a few possible mechanisms has been put forward, which is shortening of the anterior lamellae and elongation of the posterior lamella of the upper eyelid. There is a failure to fusion of the orbital septum with the levator aponeurosis, and there is a laxicity of the ligament, lateral canthal ligament. Coming to the goal of management to prevent the desiccation and allow spontaneous eversion of the lid. So conservative management, it includes moist dressing, eyelid tapping, pressure patching, topical antibiotic, lubricants, and topical 5% hypertonic saline, which we used in our case. And surgical options are scarification of the exposed conjunctiva, temporary tarsorrhaphy, subconjunctival injection of hyaluronic acid, fornix sutures, full thickness skin graft to the upper lid, and compression eyelid sutures. Lid manipulation should be avoided in neonates, especially to prevent the respiratory arrest. And complication could be secondary infection, epimerization of the conjunctiva, and some patients corneal perforation is reported. This article is presented in IJO in October 2020. So my take-home message is presentation is really alarming, and it really needs urgent attention to prevent secondary complications. And my case was get cured with the help of medical management. So we emphasize on conservative approach, and awareness among healthcare personnel is really important, especially the neonatologists and pediatricians to see who are seeing it for the first time. Thank you so much.
Thank you, Dr. Nilesh, for the excellent presentation. Do you have any questions for him?